The member for Pascoe Vale.
Thank you, Deputy Speaker. I rise in support of the Children and Health Legislation Amendment, Statement of Recognition, Aboriginal Self-Determination and Other Matters Bill 2023. In beginning, I would like to acknowledge the traditional owners of the land on which we meet, the Wurundjeri people, and pay my respects to elders past, present and emerging. As I stated in my first speech, I'll be absolutely committed as a parliamentarian to building a fairer and more socially just community. And at the heart of this commitment is doing what I can to stand and support First Nations communities through the Labor movement and as part of the Victorian Labor Government in striving for voice, treaty, truth and justice for Aboriginal and Torres Strait Islander people. In this respect, I'm proud to be part of a Victorian Labor Government whose whole approach to supporting the health and wellbeing of Aboriginal people has been built upon a commitment of self-determination and includes genuine and meaningful partnerships with the Aboriginal community-controlled sector, traditional owner groups and the wider Victorian Aboriginal community, all guided by Victoria's Closing the Gap implementation plan. I'd like to pay tribute to Victoria's First Peoples Assembly and co-chairs Auntie Geraldine Atkinson and Uncle Marcus Stewart, who have been playing a leading role in providing voice for Victorian First Nations communities in relation to treaty, but also in relation to issues more broadly that impact the lives of Aboriginal and Torres Strait Islander people. In Victoria, we are supporting the Uluru Statement from the Heart through voice, treaty and truth, and the model that has been established in this state, I hope, can provide the assurance and the pathway forward as the struggle towards a voice at a national level continues. And while the establishment of the Victorian First Peoples Assembly was a tremendous milestone in this state's reconciliation efforts, this bill also continues in the spirit of this Parliament's ongoing commitment to close the gap and reconcile with our past. Speaker, as we know, sadly, through the impact of colonisation and its disconnect from Aboriginal culture, that Aboriginal children are sadly 22 times more likely than non-Aboriginal children to be in out-of-home care. In terms of why this is the case, at this time I would like to remind the House of the words of the former Prime Minister, Paul Keating, in his landmark Redfern address, which in my humble opinion played a key role in reshaping the entire national discussion to help us get to where we are today on these issues. As he said on the 10th of December 1992, isn't it reasonable to say that if we can build a prosperous and remarkably harmonious multicultural society in Australia, surely we can find just solutions to the problems which beset the first Australians, the people to whom the most injustice has been done. And as I say, the starting point might be to recognise that problems start with us non-Aboriginal Australians. It begins, I think, with that act of recognition that it was we who did the dispossessing. We took the traditional lands and smashed the traditional ways of life. We brought the diseases, the alcohol, we committed the murders. We took the children from their mothers. We practiced discrimination and exclusion. It was our ignorance, our prejudice, and our failure to imagine these things being done to us. With some noble exceptions, we failed to make the most basic human response and enter into the hearts and minds. We failed to ask, how would I feel if this were done to me? Speaker, as co-chair of the First Peoples Assembly, Auntie Geraldine Atkinson has also said, there is no escaping the harsh reality that Aboriginal people have suffered immensely at the hands of the Victorian state. We were driven from our lands, murdered, herded onto the reserves, torn apart from our families. We were unfairly targeted and discriminated against for generations, with the disadvantage and injustice compounding over the years. But you know what? We have survived. We survived the concerted attempts to eradicate us and our culture, and it should be of no surprise that many of our people find it hard to place faith in government systems. Indeed, all too often, these are still the sources of ongoing injustices that need to change, and treaty is the way that we can change that. Speaker, this bill is another critical step consistent with our commitment to treaty at a Victorian level in helping us to reconcile with our past and begin supporting First Nations communities towards self-determination. This bill aims to support Aboriginal children and their families to maintain their culture, community connections and connection to country and break the intergenerational trauma that past policies have created and contributed to. The bill proposes amendments to embed recognition of Aboriginal self-determination across child protection and health. The bill requires that decision makers when considering the views of Aboriginal children, decision makers must uphold their cultural rights and sustain their connection to family, community, culture and country. This bill includes proposals that represent very significant steps in progressing self-determination for Aboriginal communities, steps that we can take now to improve the system as part of first stages of an overhaul to allow greater Aboriginal-led service delivery and improve outcomes for Aboriginal children, young people and communities as we progress towards treaty. Victoria is committed to meeting the National Agreement on Closing the Gap targets to reduce the rate of overrepresentation of Aboriginal children in care by 45% by 2031. This commitment is underpinned by the 2018 Aboriginal Children's and Families Agreement that established a landmark partnership between Aboriginal community, government and the child and family services sectors to achieve better outcomes for Aboriginal children and young people. At the heart of this agreement is a commitment to the reduction of the overrepresentation of children in protection and alternative care. This will be achieved by enabling the advancement of Aboriginal models of care and transferring decision-making for Aboriginal children to Aboriginal community-controlled organisations. This bill is an essential part of achieving that vision. The bill also supports the Victorian Aboriginal Framework, through the government working in partnership with Aboriginal people to meet the goal that Aboriginal children are raised by Aboriginal families. In particular, the bill advances a number of objectives, including eliminating the overrepresentation of Aboriginal children in care, increasing Aboriginal care, guardianship and management of Aboriginal children and young people in care, and increasing family reunification for Aboriginal children and young people in care. In the health sector, the bill progresses a major priority of the Aboriginal Health and Wellbeing Partnership Forum by enshrining commitments to Aboriginal self-determination in our health legislation. This also progresses the government's commitment to Aboriginal self-determination as set out in the Victorian Government's self-determination reform framework. Through this bill, this Parliament will specifically acknowledge Victoria's treaty process and our shared aspiration to achieve increased autonomy and Aboriginal decision-making, which includes greater control of planning, funding and administration of services, including through self-determined Aboriginal representative bodies established through treaty. Through this, the government will make clear our commitment to treaty and the reform work that is currently underway. To achieve these goals, the bill focuses on the following key objectives: providing for an Aboriginal statement of recognition and accompanying set of binding principles to guide decision-making regarding Aboriginal children, expressly including all 5 elements underpinned by the intent of the Aboriginal Child Placement Principle, namely prevention, participation, partnership, placement and connection, and strengthening provisions to enable the effective functioning of the Aboriginal Children and Aboriginal Care Program, including enabling authorisation of Aboriginal-led organisations to undertake investigations, respond to therapeutic treatment reports and access information through the Department's client-based data, and as well as removing outdated and offensive terminology from the Act, which I believe my colleague, the member for Albert Park, made reference to earlier. Speaker, I understand that one of the highlights of the 59th Parliament was the introduction of the Treaty Authority Bill last year. I understand that members took part in an emotive smoking ceremony on the steps of Parliament, where the traditional owners of the land was followed by the historic moment on the floor of this chamber as the co-chairs of the First People's Assembly made an address. Each member of the Assembly walked through this place and then was here in the gallery to hear those incredible works from Uncle Marcus Stewart and Auntie Geraldine Atkinson. And it is in this spirit of bipartisanship that I hope to see the 60th Parliament work together when it comes to questions and policy reforms that support the best outcomes for First Nations people. As the Victorian Aboriginal Childcare Agency CEO and First People's Assembly of Victoria Representative Professor Muriel Bamblett AO has said, this bill represents what can be achieved when Aboriginal community-controlled organisations work with their communities to demand better outcomes for children and families, and the government actively takes up the challenge and commits to self-determination. In this respect, I would like to also draw the House's attention to the good work of the Victorian Aboriginal Childcare Agency, VACA. VACA is a statewide Aboriginal community-controlled organisation servicing children, young families and community members. The largest of its kind in Australia, VACA have protected and promoted the rights of Aboriginal children and family for 40 years. As recommended in their submission to the Yurruk Justice Commission from December 22, VACA has called on the Yurruk Justice Commission to call on the Victorian Government to pass the Children and Health Legislation Amendment Bill as an urgent priority, and I'm very pleased to be standing here and say we're progressing on that now. VAC has called on the Yurruk Justice Commission to look more closely at the status of the recommendations of previous inquiries that relate to the rights of Aboriginal children and families. And VAC has also called on the Yurruk Justice Commission to convene hearings with private child and family service organisations that may hold records or materials of stolen generations or their descendants to gather testimony on their involvement as non-state entities in forcibly removing children and to consider that in the current context. In conclusion, Deputy Speaker, this bill makes significant progress on embedding Aboriginal determination in the laws of this state. It also makes a number of changes to increase the effectiveness of Victoria's legislative system. Most importantly, this bill represents a very tangible step towards empowering and supporting Victoria's community to improve outcomes for children and families and improve the health of the First Nations communities. I commend this bill to the House, and in doing so, I would like to acknowledge Victorian Senator Jana Stewart, who is Victorian Labor's first First Nations senator, who's undertaken phenomenal work in this space and who I'm so honoured to call a dear friend, and he's a strong advocate on these issues. I commend the bill.